Good morning. This is Dena Diorio, Mecklenburg County Manager. I am joined this morning by Public Health Director Gibbie Harris, as well as Deputy Chief Estes from CMPD. Just a few things from me this morning. As you are aware, Governor Cooper extended his stay-at-home order until May 8th and then has put out a three-phased plan for reopening the state. We were very, very pleased about not only the extension of the stay-at-home order, but the plan that the governor has put out, we think, is incredibly solid for a lot of reasons, but the most of which is that it's data-driven. So it allows all of us to understand what we need to see in order for us to continue to lift the restrictions, not only here in Mecklenburg County, but in the state of North Carolina. So we are very pleased about that, and that extra week of the stay-at-home order allows us to continue our planning in preparation for when we can start lifting some of the restrictions. One of the things that we've talked about this morning and that we are going to allow on a go-forward basis beginning today is drive-up church services. We have gotten a tremendous amount of cooperation from our faith leaders around not having or not holding drive-up church services, but we feel now that our data and the flattening of the curve allows us to allow those churches to do drive-up church services, but we are not going to permit drive-up communion. We think that still presents a tremendous risk to the community. And so we'll be putting that announcement out right after this press event so the churches in the community that are interested in doing drive-up church services will be able to do so this weekend. I'm also really pleased to report that I had my first meeting this morning with my Business Leaders Roundtable. It was a very, very energetic group, very, very good discussion. They have a lot of great ideas. It's clear that they are interested in being part of the solution and want to guide us as we continue to talk about how we reopen the economy. So it was very well received by the group, and we're going to continue to meet. We'll probably have another meeting early next week and go over some of the recommendations that we've talked about. The other thing that we are doing is we want to get input from other businesses throughout our county, and this was actually a recommendation from Commissioner Elaine Powell on the Board of County Commissioners to have an opportunity to hear from other businesses in our community. So we have put a link on our website. It should be on the front page of our website, mecnc.gov, where businesses can click that link and fill out a form, provide their business information, ask questions, give us ideas, give us their concerns. One of the things that we've talked about is if we do start, once we get to that place, that we can start letting some businesses reopen. Do they have what they need in terms of supplies and equipment in order to be able to operate safely? Those are some of the things that we need to know from our business community. So we hope that the businesses in Mecklenburg County will take advantage of that opportunity and provide us input on how we can better serve them as we look at reopening our economy here in Mecklenburg County. So that's really all I have for you this morning. At this time, I'll turn it over to Gibbie Harris for the public health update.
Good morning. I have a brief report this morning. We have updated our data on the website this morning for data through April 22nd. Our numbers this morning, we have reached the 1,400 mark in terms of number of confirmed laboratory tests in Mecklenburg County, and we are at 38 deaths. We are looking at the trend data as the state is looking at. What we're seeing at this moment is fairly flat trend data based on the information that we have available to us. And you will notice in the data that we did release this morning that there is an additional graph that shows the cases reported by date. You will also notice that on April 22nd, we had our second highest date of cases reported in Mecklenburg County at 76. So we're continuing to watch the trend data carefully. And as we open things up in our community, as the state opens things up, we'll continue to look at that trend data, and it will inform the actions that we take moving forward. I also want to talk a few seconds about our long-term care facilities. We continue to have outbreaks in 8 facilities. We're working with them very carefully on a daily basis, making sure that they have the supplies and the equipment that they need to isolate the individuals who are infected and to protect both the staff and the rest of the residents in those communities. I do want to take just a second. We talk a lot about the first responders and the healthcare workers who are on the front lines of this work. But I do want to take a second to recognize those who are more behind the scenes, who are working daily through weekends and in evenings to make sure that we are coordinated in our efforts in this community and that we are moving things forward in a positive way. Those include all of the individuals that are working through our Emergency Operations Center, our emergency management staff who are coordinating all of these efforts, our public health staff who is working daily to do contact tracing to make sure that individuals who are, excuse me, who are infected are receiving the services they need. We have a whole team of social workers who are contacting them and helping them access the resources they need so that they can stay at home. Those workers in our long-term care facilities, we have individuals working in our parks to make sure that we're social distancing and doing the work we need. There are a lot of individuals providing child care in our community so that essential workers can go to work and provide the services that we need. All of our essential workers who are out there every day providing the service, grocery stores, pharmacies, those individuals providing transportation. There are many who are still working in our communities and are potentially exposed every day to make sure we have those services we need. Our schools are feeding many people in our community. Our Sheriff's Department is helping deliver some of those meals. And we have significant number of volunteers who are working with all of these entities to make sure that people are getting what they need. And I personally want to thank them. It shows our community coming together in a very positive way to make sure that those most in need are getting what they have to survive as we move through this pandemic. I also want to reinforce that even as we are talking about loosening things up and trying to move slowly and intentionally towards a more normal situation for us in our community, that it's still important for us to maintain social distancing, to wear your masks when you're unable to do that, your cloth masks in the community. So please, that has been successful here. We have seen our curve flatten. We have seen fewer cases. We have seen fewer numbers in our hospitals. And that is what we need to stay focused on. So we need your continued cooperation and maintaining that social distancing and the masking that we need to make sure that we are protecting those most vulnerable in our community. I appreciate everything that everybody's doing and just want to reinforce that we need to stay the course. Thank you. And now I'll turn it over to Chief Estes.
Good morning. Thank you, Gibbie. Just very quickly, short from us, as we said from the very beginning, this pandemic response necessitated and required cooperation on a voluntary basis from the citizens of our community. And we have seen that in large measure. Now it feels like to me sort of the seventh inning stretch here. We have to ensure that we're doing our very best from a personal perspective and from a community perspective to ensure that that we carry the success we've seen thus far all the way through. So as we begin to talk about loosening the restrictions, we need to do so in a responsible manner. And the men and women of the law enforcement here in the areas and public health providers are out and about making sure that that takes place. So, so far so good, and we're looking forward to more success in the future. Thank you.
Thank you, Gibbie. Thank you, Chief Estes. At this time, we can open it up for questions.
Dena?
Yes.
Dena, this is Eric Spanberg, the Business Journal. I wanted to ask you on the Business Roundtable, will those meetings going forward be publicly accessible? And how many meetings are you thinking about? And just give us an idea of how the format might look.
So at this point, they're not public meetings. So there won't be any, we won't open them up to the public. We will continue to meet, I think, until we get to the point where we are at a full reopening. What I told the group this morning is the purpose of our group is very short term. We are looking at sort of a 90-day time frame for which we can ease the restrictions on a phased basis and get our economy back to full opening. There are other groups that are looking at sort of more the long-term recovery piece, but this group is really focused on what we need to do to be able to reopen the economy safely in a phased manner. So we will continue to meet over the next, I would say, 90 days or so until we get to the point where we're at full opening.
Dena, this is Hannah Smith with the Observer. Can you explain exactly why those meetings will be closed? What's the legality of keeping those closed to the public?
Well, it's not a public meeting of the Board of County Commissioners. It's a meeting that I'm holding with business leaders in the community, and it's not subject to the open meetings law.
Dena, you say that they're business leaders, but a lot of them are just PR people, community relations people. You've got a lobbyist on there. You've got someone from the governor's office in there, people who have no experience running businesses themselves. So how did this list come together?
The list came together based on a number of different sources. I talked to Center City Partners, Charlotte Business Regional, Charlotte, the Alliance, and got some names of people. I wanted it to be broad. I wanted to make sure that we covered as many sectors as possible, which is why I included the various chambers. We did want a representative from the governor's office so that if there's questions that we have that need to be elevated to the state level, we have a means of getting those to the governor's office effectively. And so they are individuals who reflect a very, very vast portion of the economy here in Mecklenburg County.
But even if they are representing companies from like California, like Lyft, without really brick and mortar or something like that, like is it a lobbyist that's actually on this that lives in Wake County, or people who have no experience running businesses like PR people?
Well, the Retail Merchants Association represents retail merchants across the state of North Carolina. They are an association. They don't run businesses, but they represent business interests, and they have a very, very good feel for what retailers in the state of North Carolina and in Mecklenburg County are experiencing as part of the pandemic. So it is a perspective that they bring that we think is incredibly important. Other organizations don't have bricks and mortar here, but they certainly operate here. And so we felt it was important to have a very, very broad view of who operates in this community to make sure that those perspectives are being heard.
Hey, all, it's Joe. Gibbie Harris. My question is about hydroxychloroquine. It's my understanding that the Department of Health and Human Services has obtained a donation of it for long-term care facilities with outbreaks. Do you know if any of our local outbreaks are using hydroxy, and what's your perspective on it?
I'm not aware that any of our long-term care facilities have accessed that at this point. I can check into that more closely. I think the jury's still out on that drug, as well as a number of other drugs. Unfortunately, when you're doing quick studies, which we've only had time to do around this, you don't have the full picture. So I think what I'm seeing is it's being used judiciously in locations, hospitals where there are significant issues, and so I think we're waiting to see. I will double check to see if any of our facilities are using it at this point, but I don't have that answer.
Gibbie, this is Christina Bowling from the Charlotte Ledger, and I'm wondering how many people are currently hospitalized in Mecklenburg County with COVID-19?
Let's see if I have that data. We were pulling additional data this morning. I've got bed counts. I don't have the specific number, but we're looking at probably around 90 individuals, 91, I think, currently being hospitalized in Mecklenburg County with COVID-19.
Hey, Gibbie, it's Allison Kuznets from the Charlotte Observer. Could you explain a little more of the data? So it says almost all deaths were among older adults. Could you talk about the age range for those individuals who are not older than 60?
I had trouble hearing most of your question. You're talking about the number of deaths. Our data says almost all deaths were among older adults over age 60. We have had 2 deaths in individuals who were in their 50s in Mecklenburg County to date, both of whom had underlying health conditions.
Gibbie, this is Eric Spanberg at the Business Journal. You mentioned this week, you gave the figure of 20,000 tests. That's the first time that we've had a specific number. I'm wondering, with Secretary Cohen talking about essentially doubling the number of daily tests statewide, what's the number in Mecklenburg that needs to be reached as you're thinking about loosening restrictions?
That's an excellent question. We are actually have a meeting this afternoon to talk about what our plan is for testing moving forward. At this point, we have been using the CDC guidance to restrict our testing, basically because we've got limited access to testing as well as limited access to PPE. But we want to look at what we would like to see in the county and develop a plan on how to get there. So there will be conversation about that this afternoon, and hopefully we'll have more information next week.
Gibbie, it's Hunter with WCNC. Following up to that question, once restrictions on testing start to loosen up once we get more testing, what are you wanting to do with that additional testing? Because right now it's my understanding that only first responders or people with symptoms are getting those tests. Are you wanting people without symptoms to be tested?
At some point, we do want the test to be much more available to the community, but we also want to be intentional about how we make it available as we can grow the amount of testing available. So that will be part of the plan. If there are specific individuals, specific groups of individuals that we believe need to be tested, we'll focus on those first. There's also the difference between the tests that are currently being used now, the swabs, which will let you know whether you are infected or not, and there's the antibody test. And we're continuing to watch what's happening in the laboratory industry right now in terms of the development of those antibody tests, and that will be another part of the consideration moving forward.
This is Paige from WBTV. Question for you regarding the data so far. Do you think in the next 2 weeks we will see enough of a downward trend in Mecklenburg County to begin phase 1 on the 8th?
I think if I understood the question, you're asking whether our data is going to demonstrate that we're ready to start opening things up on the 8th. Is that accurate?
Yes.
At this point, as I mentioned, our data appears to be fairly flat when it comes to hospitalizations, when it comes to positive test results. If we're looking at a 7-day average, which is what the state is looking at, we're going to continue to watch that. It's flat. It's not going up significantly. It's not coming down significantly. And I think it's going to be important for us to realize that as we open things up in our communities, that it's going to take a week or two after that for us to really understand how that is impacting that data, because people don't become infected immediately once you start opening things up. So we're going to be watching that all very closely, and we'll be reporting that out as we move forward.
It's Claire Donnelly from WFAE. Oh, sorry, Joe. Oh, God. It's Claire Donnelly from WFAE. I just wanted to know how many contact tracers the county has. And then I know Mandy Cohen said yesterday that they're trying to hire get to 500. I wondered how many of those would be in Mecklenburg.
So we don't fully understand the state's plan around contact tracing right now, and have not been depending on that. We currently have about 300 staff a day who are doing contact tracing. What I heard from Dr. Cohen yesterday is that they hope to double the number of contact tracers in the state over the next month. And what I can tell you is we're in a position now to be able to double contact tracers in our department when the need arises. We're utilizing our school nurses. Obviously, they have not been in the schools, so they have been trained to do contact tracing, and that has increased our capacity significantly.
Is there any update to peak projections now that the state stay-at-home order has been extended, or is that still expected on that late June date?
The graph that you saw earlier this week really hasn't changed very much. It continues to waffle a little bit based on the data, but we didn't see significant changes over the last couple of days. Right now, what we're looking at is a peak sometime in June based on the modeling that we've been doing.
Ms. Harris, I hear what you're saying, and then I see the models that you're showing. You're saying that the data is flat. We only have about 91 people hospitalized currently for COVID-19. Do you really think that we're going to see thousands of people being hospitalized in just 2 months?
As I said, the data is only as good. I mean, the graphs, the charts, the modeling is only as good as the data that we have available to us. And as you know, there are multiple models out there that show lots of different things because all of the models depend on the data differently and make different assumptions. At this point in time, I'm more concerned about our trends and what we will see as we start loosening things up. So we continue to plan for the worst. So we're continuing to have conversations with our hospitals about their surge capacity. We're continuing to look at what we may need to do if they ever meet surge. All of those conversations are continuing to happen so that we are planning for the worst case scenario, but at the same time staying focused on our trends and how the loosening of restrictions in our community affects those trends. So that really is our focus right now.
But are we trending toward a worst case scenario?
Right now, as I mentioned, our trends are fairly flat. They're not improving and they're not worsening. So we're going to, as I said, we're going to continue to watch those trends over time and we'll act accordingly.
This is Katie Peralta with the Charlotte Agenda. I had a quick question for Dena about the reopening of the economy. Obviously, we heard sort of what the state has in mind in terms of phasing in of a reopening. How much leeway will the county have in what that looks like? In other words, will the Business Roundtable be able to dictate things like, you know, what a capacity in a restaurant would look like, for instance, or what cleaning standards might look like?
So they're not going to be able to dictate their advisory, but their input is critically important. And so what we'll do is we'll take the continued guidance from the state in terms of what they're recommending in terms of how these businesses open up. We will talk to our business roundtable to get feedback from them about whether or not that's feasible or not, or what things we need to consider in order to do that. And then we will develop our guidance accordingly. So it's really, again, just an opportunity for input and collaboration from the business community about what the phased reopening looks like.
Dena, this is Eric again. I'm curious, when you're talking about that business roundtable, I know they don't set policy, but how much policy do you think they will suggest or recommend that you will ultimately take to the board as you're trying to reopen the economy?
Oh, I think it'll be very significant. I think, you know, they're the ones that have to reopen. They're the ones that provide these services to the community. So I think that their input and their guidance is going to be critically important and will weigh heavily on the decisions that we make.
So why not make the meetings public so people can hear that debate?
Because it's not a public meeting, Eric. It's a closed meeting.
Gibbie, this is Brett Jensen again. I'm curious, do you excuse me, I'm sorry, this was for Dena. My apologies. This is for Dena. My apologies, Dena. Sorry. Do you understand the thoughts of our neighboring counties like Gaston County, Union County, North Lancaster, who really wanted this to go back open and like phase one to already begin? And do you understand where they're confronted? So many counties have had very few, less than 100 cases or right around 150 cases since this whole began. Understand where they're coming from?
I absolutely understand where they're coming from, but we have always said from the very beginning that we were going to make our decisions in Mecklenburg County based on the epidemiology that we see here locally. And again, if you look at our numbers compared to other counties surrounding us, even if you compare us to Wake, we have considerably more cases. We have more people here, we have more density here, and so we have to look at things a little bit differently. But I fully understand. I think we all agree that the most critical thing we want to do is to reopen our economies. There's no debate about that. The question is how quickly we do it and how the phasing works. But overall, we're all in agreement about what the next steps need to be.
Were you a little surprised that he didn't leave it up for each county to decide? And had Governor Cooper done that, do you think you could have gotten unanimous agreement on still keeping Mecklenburg County locked down?
So to your first question, I'm not surprised that he didn't just let the order expire and let each county make their own decisions. And because I knew that they were going to be looking at it from a data perspective, and their phase reopening is data driven. And I think that makes this an incredibly strong model. And so if in fact he had not extended his order, we would have had to gone back and talk to our towns and see what we would have been able to come to agreement on in terms of extending an order. I don't know if we would have been successful at doing that or not, but that would have been our next step.
It's Hunter. As the state's phases begin in May, will the county set any of their own restrictions to those state phases?
We won't be any more restrictive than what the state phases are. And so we will have to look at how the state expects us to implement those. And then we'll have to look at locally what that means for us and figure out how we will comply. So we don't intend to be any more restrictive than what the state's plan outlines at this point. Now, that, again, as Gibbie said, one of the things that we're doing is that we are looking at our data locally. So what you saw Dr. Cohn present yesterday was statewide data and those trends around what's happening statewide. We know that Mecklenburg County can either make those trends be better or we can make those trends be worse. And so we really want to look at our data locally so that we can help inform what's happening here and to see if we need to make some different decisions, but the data will ultimately tell the story.
This is a question for Gibbie. This is Christina Bowling at the Ledger. Atrium and Novant have both said this week that people are not going to the hospital for serious illnesses because they're afraid. Is that something you're worried about?
You know, I can't speak to that. I think that's something that the hospitals will have to speak to. I would be concerned. We are seeing some reductions in the number of transports by medic, and our hospitals have sort of maintained a steady occupancy rate, not going up, not going down. So it's hard to know. People are still having health conditions that require them to be in the hospital, require them to be seen at the hospital, and hopefully they're feeling safe enough to do that. The hospitals have put great steps in place to make sure that people are protected as they come in, and we have worked diligently with them to make sure that individuals coming in who may have COVID or may be exposed to COVID are distanced from the rest of the population, say in the emergency department. So I'm confident that people can be safe going to the hospitals and receiving the care that they need to have.
I know we've seen some essential workers wearing face masks like in grocery stores and such, but we've also seen some jobs where social distancing is very difficult, like construction jobs, where a majority of some of them are not, of those workers are not wearing face masks. Do you recommend them do so? And have you guys been in touch with construction companies to make sure that they're putting those safety measures in place?
We have had some conversation with construction companies on construction jobs in the county around making sure that their staff are safe. We have made a recommendation that when you're in public, if you cannot social distance, that you do wear a cloth face mask. We have not required that, and part of the reason for that is everybody doesn't have access to one. So we don't want to restrict somebody's ability to go to the grocery store just because they don't have access to a mask. We are having conversations about how we can make masks more available to certain populations who may have trouble finding masks or getting masks, and we'll continue to work on that.
One more question, please.
Director Alex Shabad with WCNC Charlotte. This is a message for a question for Director Harris and Manager Diorio. Have you guys been tested for coronavirus, and do you intend to be tested again if you have been?
I have not been tested. I'm having trouble with allergies, and I'm pretty sure that's what's going on here. I've had no fever. I've had no reason to be tested at this point, and we'll continue to watch that. I get checked every day as I go into the Emergency Operations Center, and so far have passed the screening. So no, I have not been tested.
Have you not been tested? Oh, okay.
I have not been tested either.
Have you guys not been tested because of the availability and you're saving it for others, or what's the reason for not being tested?
That's the reason for not being tested. I can tell you that while Gibbie goes to the Emergency Operations Center every day, I actually have been home 90% of the time. I either come here to do one of these media availabilities or I'm at home, and I have not demonstrated any symptoms, so at this point there's no reason for me to be tested, and because of the limited availability of tests, I don't feel it's worth me taking up a test when others need them more than I do.
Dena, this is
Director Harris, what's the reason you said for why you haven't been tested?
Because she goes to the emergency operations center every day and they take her temperature when she gets there. And if she had a temperature, they wouldn't let her in. And every day that she's gone, she's passed the screening. Next question, please.
Dena, this is Eric. Can you update us on the $5 million small business loan fund and the $1 million micro business? How much has been awarded so far, and what's the status of that?
I don't have the latest stats today. I'll get an update for you guys and I'll push that out. I just don't have any updated numbers right now. So thank you very much, you guys, for taking the time to be with us this morning, and hope you all have a good weekend. Thanks.